Good evening, everybody. How are you today? Welcome to our health condition workshop with BioTouch Healing, and we're going to talk about hormone imbalances today for all genders. And as you can see, we have a little guest with us, Dr. DeeAnn Saber. Hi, DeeAnn. How are you today?
I'm doing good. Thanks, Paul.
Good, good. So we're going to just let her take over. She has a center here in Tucson, Arizona called Transformational Medicine, and there's her website up there, and we're going to let her do her little spiel with us, and then we're going to teach you the points on how to work with hormone imbalances. If you have any questions, just post them in the comment section, and we'll get to them sometime in her little dialogue. So take it away, DeeAnn. Thanks for being with us. Awesome.
Thank you, Paul. I
Yeah,
appreciate the invite.
you bet.
Good evening, and I pray that tonight finds you well and ready to learn and question. And as Paul said, I'm Dr. DeeAnn Saber with Transformational Medicine. We're over here on North First Avenue, and I'm a naturopathic physician. So as a naturopath, I do whole person care, but my specialty is endocrinology, and that includes what I call HPAT, or your hypothalamic pituitary thyroid adrenal connection. I can point to it sort of. Anyhow, and what's really some new exciting research that another colleague of mine has brought to my attention is looking at gut health, and in particular, our microbiota, which is the word for the healthy bugs in our intestines, actually help hormone production and support. And I always talk about the gut as the foundation of the house. And so it's interesting to find out that we can, through what we eat, fix the missing bricks in the foundation of our houses so we can be strong and healthy and have the energy that we want to live our best lives. So pretty exciting to learn about that. So endocrinology is endo, which is gland. Okay, I've just blanked on what chronology means. Anyhow, the point is we're talking about the glands that support men and women to have their healthy lives. And we use these hormones through our whole body. They help us feel good. They give us energy. They help our skin. There's many, many things that we want to look at in regards to balance. There's really 5 basic things that I always recommend for hormonal health and really all of our systems health. Okay, I'm going to have to move here. Just one second. There we go. Okay. Eat clean. Okay, so if what you put in your mouth matters, which it does, and we're trying to get our guts to work properly so that our hormones can work properly, this means we need to eat stuff that's fresh, alive, organic, grass-fed meats, seasonal would be fantastic, and local as possible. There's also something specifically that helps support healthy hormone production, and that are healthy fats. Healthy seeds in particular have something called lignans, or omega-3 and 6 and 9 fats, such as flax, sunflower, sesame, pumpkin seeds. All of those provide healthy fats that actually support our healthy hormones. Of course, this is assuming, eating cleanly, that you're not eating highly processed foods full of phony sugars and chemicals that our insides really can't use as fuel. So that's number 1, eat clean. Number 2, drink plenty of clean water. You know, you live in Tucson or wherever you are, we gotta drink clean water. Staying hydrated helps all of our cells work better. Water is life. And we can only go about 3 days without water, though we can go weeks without food. So don't put yourself in the hospital from dehydration. Number 3, get enough sleep. Sleep is so vital, and most people don't sleep enough. We're worried, we're stressed, particularly in this time. And, we've got a very odd situation that's unprecedented, right? And we are spending time on our computers, our phone, we're in front of the TV, and time goes by and we don't get enough rest. It's really good for your short and your long-term health and your brain and your hormones to sleep 7 to 8 hours a night. Now, what you want to do, I'm sorry, I'm going to have to keep moving, is think about what works for your life. What's your schedule? Whatever that is, try and make sure that you schedule in 8 hours of shut-eye. What happens when you sleep is there are hormones that flood your body to deepen your sleep. They assist your body in cellular repair. Your fight or flight responses calm down. Your cortisol levels decrease. There's actually a particular hormone your body releases that tells your body, quit trying to go to the bathroom because we're trying to sleep here. And that's your antidiuretic hormone, or ADH. Also, your immune system shuts down inflammation. So you need a good amount of sleep for your body to reset. Number 3, that's enough sleep. So number 4, exercise. Regular exercise has shown in lots of research to be the number 1 thing to clear up depression. Move. I don't care what you do something that you enjoy and that you're not going to hurt anyone else doing, right? Walk, dance, hike, bicycle, jog, swim, yoga, martial arts, powerlifting. My favorite is dancing. So I always encourage people. Moving increases your circulation. It raises our endorphins. Those are our happy hormones, right? Get outside and garden, walk your dog. So all those kinds of things help actually support healthy hormones. The 5th thing really is to reduce stress in your life. Okay, I know it's easy to say, it's not so easy to do. But the fight, flight, or freeze response, and a lot of people have pretty high cortisol or adrenaline going right now. So adrenaline is your adrenal glands pushing or you to, go into fight, flight, or freeze. So these can be useful responses in appropriate situations. But on our day-to-day basis, we really don't need to be getting, that wound up about normal stuff. And how do we figure that out? So I always think about the question, what is most important? What is it that we need to be really concerned about? One second here, sorry. I actually use a different question for me. Is my bottom line is someone going to die if I don't do X, Y, and Z? And because I'm a doctor, I think that's kind of funny, really. So, so that's my bottom line. It's just to give me perspective about what to do, what kind of emotional or emotional energy really to give to something. I do often tell my patients, I'm like, look, you really have no control over people, places, or things. And you don't want to give headspace to those things anyway. You're giving them like free rent in your brain. So if you can consider, all those outside circumstances, you don't really need to stress about it. It doesn't help you at all to stay healthy. So the next thing really is to find out, okay, you're doing the basic stuff. What would a hormonal imbalance look like? So here's a list of a number of things. Do you feel stressed for no reason? Are you moody and you don't really know why? Are you not able to sleep? Are you sleeping too much? Is your hair getting so dry it feels like straw and it's falling out? Are you having difficulty losing weight, or you really can't gain weight? That's another thing too. Do you have no libido? If you're a menstruating woman, you could have irregular menses, or you feel like you're crying at the drop of a hat. If you're postmenopausal, are you having hot flashes? Is your sleep really disrupted? And oftentimes for men, they also can have no sex drive, or they have erectile dysfunction. If you find that you say yes to any of these issues, you most likely have some type of a hormonal imbalance. And imbalances really impact our lifelong health. I kind of look at endocrinology as a three-legged stool. So we have adrenal, hormone, and thyroid. Really, the base of the stool is your gut. But if you don't have those three things balanced, or even one of them balanced, your chair is going to fall over. So it's important to look at the whole picture. I do have a reference if people want about it's called microbial endocrinology, and it's the interplay between the microbiota and the endocrine system. And it's like a 20-page list of how each hormone in the body is impacted by particular probiotics or healthy gut bugs. So I can send that reference if people are interested. It's pretty in-depth. But the other thing, so let me see.
Yeah, it would be nice to send that to us, and we'll post that on our website and send it in the email. So that would be great.
Okay.
Yeah.
Sure. So hormones coordinate all of our biochemical activity really that occurs in our cells and in our brains. And part of why I think, it's good to talk about the gut too, is they found that the nervous system of the GI of our gut is really like a second brain. It has that much going on, as much as our brain. And now we know that that particular chemistry that's happening in our gut is actually impacting our brains. There's certain bacteria that make serotonin and dopamine, for instance. So what else? They also impact our metabolism. So that's why our body composition changes. They impact our moods. They can impact our strength, and how much activity we can do or not do, like if we're fatigued or not fatigued. So these hormones are continually bathing like all the tissues in the body. Excuse me. Okay, I'm going to talk a little bit about each one of them. So estrogen, and this is not just for the ladies, so men have a small amount of estrogen as well. It's really the most powerful hormone in the human body. And I think estrogen sometimes gets a bad rap because people talk about estrogen dominance, and that's terrible. And we have to have a certain amount, or, somebody, whatever you believe in, if you want to say God or whatever, put it in our bodies for some reason. So we don't know, but it helps our urinary tract. Okay, so that's men and women. It helps our skin. It helps our blood vessels. And for women in particular, it helps our breast tissue and our reproductive stuff like uterus, ovaries, and vagina. I think most of you know that estrogen starts to rise in girls right before puberty. You've got the hypothalamic gland talking to the pituitary that then releases all these hormones. I don't know if I really need to go into all that, but I think a lot of what women start experiencing is in your 30s, you're starting to have a declining level of estrogens and hormones, and estrogen, progesterone particularly. And what that does impact is women's fertility. So if you were trying to have a baby, later in life, you really need to have somebody look at all your hormones, including actually your thyroid hormones, which we're going to talk about in a little bit. Mid 40s until usually women go through 50, 55, they go through menopause. And then there's a really rapid drop in the hormones. And of course, I shouldn't say we, because I'm postmenopausal, so I think everybody is, but no. There's a lot of things that happen. Our hair gets dry, it become more brittle. You can actually lose, your body hair can get more sparse. You can have a loss of libido, and you can get various mood swings. And of course, you can get the temperature changes, which are really annoying. Then we're going to look at progesterone. So progesterone is actually made by the ovaries by menstruating women, and it impacts our cycles pretty intensely. It's also produced in the placenta to help maintain a pregnancy. So some women that I've worked with that are looking at having babies have had to take some additional progesterone to get pregnant and to maintain their pregnancies. So that's pretty important. It's also made a little bit by your adrenal glands, so it can impact your adrenal hormones as well. What else? So I got more information about what happens in the body, but I don't know if I need to go through that. So ideally, women's menstrual cycles, your estrogen and progesterone levels do a certain kind of a rise. And then when they dip, that's when you have your menstrual cycle. What is interesting, I think, if the levels of progesterone are inadequate for a menstruating woman, you can actually, and what happens then is the estrogen goes too high, is you can get fluid retention. You can have low blood sugar levels. Your body encourages your body to develop fibroids, which often runs in families. It can increase your cholesterol and triglycerides. It can impact allergic reactions. So having enough progesterone with your estrogen really can make a huge difference for people.
I had a question based on that one.
Okay.
And somebody's asking about, does an estrogen imbalance in men contribute in any way to prostate issues?
I am not sure about that, but I would be happy to look it up and let you know.
Right.
Want to email me. It's interesting because, the research and the literature says there's estrogen receptors everywhere. So why not in the prostate, right? Though generally for men, the bigger things that are produced, of course, is the testosterone.
Right.
So,
okay, perfect.
What I really encourage people in regards to estrogen and progesterone for women is if someone is prescribing you to take estrogens, please do not take them alone. Taking them with progesterone is protective against endometrial and breast cancer. Taking estrogens only really causes what's called estrogen dominance, and that is really like a precancerous state. So I would encourage you to not do that and, check with your healthcare practitioner about that. Okay, so testosterone. So a lot of women think of testosterone as the male hormone, but women have it and it helps them as well. It's kind of interesting. Our ovaries produce like a tiny amount, 0.3 milligram of testosterone a day, compared to like 20 times that for men. Testosterone does also help women during pregnancy as well. It helps in the development of the embryo and plays an important role in our physiology. What that means is it helps your tissue, it helps you with your sense of well-being, It can help you with your libido and just your overall vital energy. I mean, if you think of, young men and women, they've got plenty of hair on their head, on their bodies. Their skin is usually very shiny. Their hair is very shiny. All those kinds of things are supported by testosterone. Actually, something I learned today, which in getting ready for this talk, I did not know, as there's testosterone receptors in nipples of developing breasts and in the clitoris and vagina for women, and that those receptors increase the sensitivity to stimulation, that's kind of fun to know. So testosterone also contributes to cellular health as well, helping your cells actually use your food to the best way to help with your growth and cellular maintenance. What often happens, again, as we were speaking about progesterone and estrogen, is testosterone as well goes down in postmenopausal women. And so considering using them once you are postmenopausal as a way to promote health is something we're going to talk about here a little bit. So, okay, what about for guys, right? So men often have testosterone that goes down also when, I think you could call it menopause in a sense, over 50, 55, 60. I think it's important for men to get their total and free testosterone checked, as well as something called sex hormone binding globulin, or SHBG. This is like a hormone carrier in a sense, and does impact how well your body is using testosterone or shuttling it around like where it needs to go. So it's not uncommon that a lot of my men clients, and I do see men and women and children too, but that over 55 either are having a low testosterone or erectile dysfunction, and there's many different ways to address that. But of course, it's generally because I spend a lot of time with my clients, I make that an individual plan for them. So usually for men, testosterone is can be supported nutritionally as well, and with something called DHEA, which we're going to talk about here in a little bit, because the other way is to do topical, or basically to give yourself injections, which sometimes people don't want to do. So not necessarily fun, but useful. Let's see, what else about testosterone? The biggest thing is, generally if a person was using too much testosterone, and particularly for women, let me say for two different things. So for women, if they get too much testosterone, they get worried they're going to have a bunch of facial hair growth or something. But if that happened, it would be that their testosterone levels were way too high. The only other thing for men is if their testosterone gets too high, they can get a lot more irritable and anger quickly, and their blood pressure can go up. So, all these things have to get monitored appropriately. So the other hormone that I'm actually a specialist in is thyroid. I've probably seen about 1,000 thyroid patients now, and that's for low thyroid, high thyroid, thyroid cancer, autoimmune disorders related to thyroid. So it's unusual that I see men with thyroid problems, though I do have some male clients, but for some reason, there's a significant amount of women that actually have thyroid issues. And the thing is that most doctors, not that I'm down on MDs, they do a heck of a job trying to help us be healthy as well. But endocrinology is looking at, where are we in the house? And so I do like 10 tests just for thyroid, because if you're, say brother Joe's in the back of the house and you're in the front, nobody is talking to each other, and we want to figure out what's happening. You need to look at the thyroid from a number of different angles. TSH is actually made by the pituitary gland, and that's thyroid stimulating hormone. And it's talking to your thyroid, which is that little shield in the front of your throat, to put out T4 and T3. So T4 actually gets cleaved, it's called, by iodine. So that's why we also look at iodine, and to see if it's helping your T4 convert to T3, because free T3 is the most metabolically active thyroid molecule. And oftentimes, doctors don't measure that, which doesn't make any sense to me, but we want to look at everything. Hashimoto's thyroiditis is actually an autoimmune disorder, and that can impact your thyroid as well. And so sometimes, people don't look deep enough to see what's happening. Actually, once I had a VA doctor told me, he said, okay, we're going to look at your thyroid antibodies only if you come up with thyroid cancer. I'm like, so that was kind of surprising. Yeah. So it's interesting to see, and, too bad really that we see so many people having thyroid issues. But if you remember that in Japan, there was Fukushima, which was those nuclear reactors that melted down. They put a lot of radioactivity in the air, including especially on the West Coast. The amount of thyroid issues has gone way up because our thyroid likes to suck up radioactivity stuff. So it's pretty easy to check. So don't forget to ask your doctor if you feel particularly what are hypothyroid things. Oh yeah, I have a little handout about this, so I was going to show that to you guys. I'm losing my notes here. Okay, here we go. Hypothyroid versus hypoadrenal. So if you're tired getting up, your hair can get dry and brittle and fall out like in chunks. You're like, what is going on? Your skin can get really dry. Your whole body temperature often goes down. Your hands and feet can be cold. Actually, I often find people's blood pressure and their heart rate are pretty low as well. You can get constipated. You can't lose weight. I have this interesting thing in comparison to adrenal. You don't startle very easily. You're just kind of sluggish and slow overall. Low adrenal is tired, but you're achy as well. Your hair can be okay. Your skin can be okay. You're not usually cold, but the sleep gets really interrupted. So oftentimes you'll go to sleep and then all of a sudden you wake up and you're like, why am I awake? Your brain like starts twirling. Sometimes it's difficult just to fall asleep. Sometimes there's a weight issue, maybe not. Often with adrenals, people have a major startle reflex, and lights and sounds and smells can bother them. So those are some stuff that's in comparison. Yeah. Let's see. There's also an interesting thing. If you're a woman who had or has premenstrual syndrome, like PMS that's pretty bad, you probably have thyroid abnormalities that, would be good to get checked out. Let's see, I guess I'm still talking on here. I got some stuff about DHEA. Wrap it up.
Yeah, I think so. Wow.
I have
Like,
Okay, I have a whole bunch more. Okay, let me tell you, I do want to say one thing. I deal with, when I deal with my patients, I talk to them about there's lots of different ways to treat your hormones. So there's food, there's herbs, there's supplementation, and of course there's prescriptions. And it needs to be right for that person, like what works for them. Um, and I do want to tell people, there's big differences between bioidentical hormones and synthetics. And personally, as a doctor, I never use synthetics. There's a lot of research that shows they have a lot of problems with them. Um,
so
so
do
I
you,
would,
so in those kinds of things to do, I mean, here we're sharing BioTouch as a possibility to add to all the work that you do as a doctor. Do you recommend things like therapy, touch therapies, massages, those kinds of things also?
yes, yeah. I think people don't get a healthy touch often enough. I actually have a background as 25 years as a massage therapist.
Uh-huh.
And I think, what you guys are offering is really wonderful, and that people can do it themselves at home. And, since we're all kind of staying at home still,
Right.
we need to know how to take good care of ourselves. Yeah.
Well, and that's the key. And all the things you talked about here, that's what we're going to teach people, how to work with the hormonal system, the thyroid, the adrenal, the pituitary. We have sets that specifically deal with that. But Dr. DeeAnn, that was like mind boggling. Like I
Okay,
told you,
I even have more to talk about, but that's
there's
okay.
well, yeah.
I know.
Dr. DeeAnn's going to have some handouts for us all, and that'll be part of the email I send out to everybody. It'll be part of our post on our website. If you're here in Tucson, or if you're not here in Tucson and you want to contact her, there's her website, tfmnd.com, Transformational Medicine, and I'm sure she'll get right back to you, and you can be anywhere on the planet and contact her. She knows how to use Zoom now.
I do. Yeah. Thank you.
Hey,
Thanks, Paul.
Dr. DeeAnn, we appreciate you hanging out with us, and we're going to spend some time now teaching people how to do the technique. So thanks for your time, dear.
Thank you, Paul. All right. You have a good
Okay,
evening.
yeah, see you later.
Bye bye.
Okay, everybody. So as Dr. Saber undoes herself here, we're going to go and teach how to do BioTouch. So let's see. Did you figure out how to
Gives you
disconnect?
those.
Down there on the bottom, it says end, leave the meeting.
Leave the meeting. Okay, thanks.
Okay, see you, dear. Bye.
Okay, bye-bye.
Okay, so here we are, my little picture all by myself, and there's our wonderful Bev Wood, who's going to be with us on Monday, and we're going to teach some points on how to do BioTouch. And I'll tell you, what I just learned there with DeeAnn was incredible, because it just reminds me of why we do BioTouch. I mean, when she talked about the stress hormones and this whole idea of the gut, real interesting. We've been hearing a lot about that. We'll have some more research on that and how to get BioTouch to work with all these gut, the brain gut, the gut brain. But when Dr. DeeAnn's talking about estrogen, the thyroid, the pituitary center, it's BioTouch. We have sets that specifically deal with that. And we want to teach those sets of points here. And so if you've never learned BioTouch, it's a very simple technique. It's one person touching another on the skin, and we just use the index and the middle finger of each hand to lightly, let's see, can you see it? Lightly touch on the skin. So if you're there at home or driving down the road, I wouldn't try it. But just take two fingers and lightly touch yourself, or better yet, somebody who's sitting next to you. The reason we try to get BioTouch out there is to make this a part of every family's protocol. So it can be done in front of the TV set. As we say in our manual, this is we have a little workbook that comes. That's the manual that we have there. And we make little workbooks for all of these particular workshops that we do. So there is a hormone imbalance workbook. If you're a member, you can download that. Just go to your member benefits page. And if you're not a member, you can join us. Actually, if you're here with us today and you go to justtouch.com/workbook, this will be there for 30 days, this particular workbook. And it will have links to the video that we're going to show here. And so it's always one person touching another on the skin lightly. There's no level of healers. Everybody's effective the very first time they do it. The kids can do it on the parents can do it with the kids, the grandparents can get involved. Whether you're going through menopause or menopause, it works for all genders, and everybody can help each other. BioTouch is a touch healing technique that, in a sense, is the gift back to humanity to reclaim our birthright to be healthy, happy, and loved. And when you have people like Dr. DeeAnn, who does the very good clinical approach and really can take the tests and knows a lot about anatomy and how it all works together, and then add something like BioTouch as a great enhancement to any healthcare protocol. There's also no levels. What's nice about BioTouch is everybody's effective the very first time they do it. I'll tell you, if you're here for the first time and you're learning BioTouch tonight, you're going to be effective. Just take any of these points and do them at home, especially if you download the manual, the workbook, and just play the video and just follow along. The words are very clear. They're very easy to understand. And I'm just checking what I got here. So that's the other thing, and requires no special preparation. Anybody can do it. You don't have to think. You don't have to center yourself. You don't have to focus. You don't have to put yourself in an all-kind, loving state of mind. You can have even terrible thoughts. You could be angry, frustrated. A lot of these techniques out there, you have to clear yourself. Well, I don't know anybody who can really do that. What's nice about BioTouch is you just start doing BioTouch. You just do the points, and the rest of it will take care of itself. If I'm in a bad mood, my bad mood just seems to go away because I've sort of bypassed my ego. I've bypassed all those things I think I am, whether it's angry or loving and kind. And BioTouch is just a very neutral approach to help another human being with their health care. Again, it is one person touching another. A lot of people have taken these points and tried them on themselves. Sometimes they're effective, sometimes they're not, but we know it's consistently effective when one person touches another. Now, when let's just start teaching it. There's always a set of points that we do with everyone, and we also have a 21-day challenge we do with people. That if all you could do is this set we're going to teach, the greeting, which is the one set we do before we do anything else. It's also the only set where you use one hand. And you're going to use your dominant hand. So pick your dominant hand, and you can sort of find these points as we show them here in the video.
The greeting is always performed at the beginning of each session. It's the only set that uses one hand and the only set that indicates which hand to use. The greeting is performed with the dominant hand. If you are right-handed, use your right hand. If you are left-handed, use your left hand. The greeting is made by touching at point 1, which is in the fleshy area just below the bottom of the breastbone or sternum. Hold this point for 6 to 8 seconds. Then, with the same 2 fingers, touch point 2 on the back. To find point 2, look for the big bone at the base of the neck. From here, move 1 to 1.5 inches to the left. This is point 2. Hold this point for 6 to 8 seconds. More than one associate may work with a recipient provided that all of the associates perform the greeting. If the associate or the recipient leaves the session, or if someone who hasn't done the greeting touches either the recipient or the associate, the greeting must be reestablished. Then the session may proceed from where it was interrupted.
Now, what's wonderful about that little video and that greeting is that was a family. And through all their time, one of the reasons that that family even got involved with that particular woman uh, had cancer and did a lot of biotouch. And the short of the story was she had another child after that one and had a healthy baby, lived a healthy life, and added biotouch to her medical protocol and just all her hormonal systems, all the chemotherapy. And there it was, that family, that young boy can work on mom, can work on dad. So that's what's nice about biotouch. Everybody can do it and everybody can notice a result. And I tell you, just by doing that greeting, you're going to reduce the stress hormones. We have research. Join us for our Mondays with Bev and Paul. We talk about it all the time. Go to our website. We have a lot of research data there that we know just by doing a few of the sets of points that we're going to show reduces stress hormones and actually builds the immune system functions of our being. So the greeting is something you always do before you do anything else. It's the only set where you use one hand, and it's that dominant hand. And again, all the points are done for 6 to 8 seconds, and they're touched very lightly like a butterfly. Okay, now the next set of points we want to do is probably the key to what Dr. DeeAnn was talking about. This will affect the thyroid. This will affect the adrenals. This will affect our whole metabolic system, and that's the name of the technique, is metabolism. And we'll show that again. If you want to practice some of these points on yourself while we're showing it, that's even that much better.
The metabolism set can be used to help the body assimilate what it needs and eliminate what it doesn't need. The metabolism set has 2 steps. Step 1 involves touching points in matching fire along the large muscles on the front of the neck. Points 1 and 1 are located above the collarbone in the soft indentations on both sides of the notch at the top of the breastbone. Points 2 and 2 are halfway up the neck on the front of the large muscles. Points 3 and 3 are at the top of the neck on the front of the large muscles. The second step involves holding a point on the front of the body and touching points next to the spine on the back. Hold point X on the front of the body is on a line directly between where the nipples would be on a youth and is 1 to 2 inches to the left of the breastbone. Another way to find X is 1/3 of the way up the breastbone from greeting point 1 and 1 to 2 inches to the left of the breastbone. The points on the back are located next to the spine, forming a rectangle around the breakover point. The breakover point is where the bottom of the rib cage joins the spine and can be found by imagining a line directly through the body from greeting point 1. To perform step 2, find hold point X on the front of the body and touch points 1 through 4 on the back. Point 1 is approximately 1 to 2 inches up from the breakover point on the left spine muscle. Point 2 is directly across from point 1 on the right spine muscle. Point 3 is 2 to 3 inches below the breakover point on the right spine muscle. Point 4 is used to address blood sugar problems and is added to the other metabolism points when needed. It is located across from point 3 on the left spine muscle.
So there you have it. Very simple set. You can see sort of why it's difficult. Well, I guess you could. You could try and get those points on yourself. But how much easier to just, I don't know, go get your neighbor to help you. So, because you could just show them how to do it. So metabolism is a key to our whole endocrine system and helping with the adrenals and the thyroid, which works with all of those different aspects that Dr. DeeAnn was telling us about. Estrogen levels, progesterone levels, adrenals, testosterone levels. Another part that deals with the whole hormonal system, of course, is everything that deals with this part of the brain. So we have the gut brain, and then we have the brain. And this next set of points works on the brain itself and that pituitary center and the central uh, mediators, whatever it is up there that tells the rest of the body what to do and communicates with all the other brains. Now that we know the gut's a brain, I've actually heard once that every cell had gray matter in it. So every cell was a brain in itself. So it's this amazing unit that's communicating all kinds of different ways. And BioTouch can help all those pieces sort of work together in harmony in a little it's a dance. BioTouch can be a dance. There's the art form of BioTouch. And we're thrilled to be sharing BioTouch with people because it's so simple and it's a rhythm. There's a rhythm to BioTouch that is so needed right now in all of our families. And so we want to teach you how to do the headset. Uh, Here we go. We'll just teach it.
The headset can be used to address conditions related to the brain. There are 4 steps in this set. In step 1, use
You can find them
ThruFire
on
to touch
yourself
points
too.
A and A. Point A on the back of the head is in the center of the neck at the base of the skull. Point A on the front of the head is at the center of the forehead where the forehead begins to curve to the crown. Step 2 is performed in crossfire with the fingers of each hand touching on opposite sides of the head. Hold at X, which is in the indentation beside the neck muscle at the base of the skull. It is the same as point 1 of the back set. On the opposite side of the head, touch points 1 through 5. Points 1, 2, and 3 are on the ridge line formed where the skull curves up toward the crown. Point 1 is above the outside corner of the eye on the ridge. Point 2 is above the front of the ear on the ridge. Point 3 is above the back of the ear on the ridge. To locate point 4, move down the head toward the base of the skull to a horizontal indentation approximately 1/3 of the way down from the top of the ear and 1 to 1.5 inches behind the back edge of the ear. Point 5 is opposite hold point X at the base of the skull. Point 5 now becomes the new hold point as points 1 through 5 are touched on the opposite side of the head. In crossfire, touch point 1 above the outside corner of the eye on the ridge, point 2 above the front of the ear on the ridge, point 3 is above the back of the ear on the ridge, point 4 is a horizontal indentation approximately 1/3 of the way down from the top of the ear and 1 to 1.5 inches behind the back edge of the ear. And point 5 is opposite hold point X at the base of the skull. Step 3 is performed in matching fire, touching points 1 and 1, two and 2, 3 and 3, 4 and 4, 5 and 5. Finally, in step 4, place the open palms of both hands on the head covering points 1 through 3. Be careful, don't let your hands touch each other.
Boom. There you go. The headset. Boy, I'll tell you, just doing the greeting in the head, your life will be different within days. It's amazing what that can do for stress reduction overall. And you're talking, to do the greeting in the head, you're talking a minute, couple of minutes maybe for you to work on somebody to work on you. If all you could do is even A&A, you'd create a healing session. So even to do the greeting in A&A, you're talking 30 seconds out of your life. Oh my gosh, folks, do we have 30 seconds? so, so, all right, we have one other set of points that work with the hormonal situation, and it doesn't matter what phase of hormones you're dealing with, thyroid conditions, but then we have that lower abdomen where the hormonal system sits, so the uterus and the prostate and all the hormonal system down in that area. And so we're going to show you the lower abdomen set.
The lower abdomen set may be used to address any conditions or organs which are located between the navel and the pubic bone. This might include conditions of the reproductive organs, the colon, the bladder, or hernias. When working on the lower abdomen, it is helpful to press firmly into the flesh. But while working firmly, be careful not to cause discomfort to the recipient. The lower abdomen has 3 steps. Step 1. Locate hold point X, which is on the pubic bone. Do not press firmly on this point. While holding X, touch points 1 through 5 with the other hand. Point 1 is located just below the navel. Point 2 is in the soft tissue to the inside of the pelvic bone, low on the abdomen. Point 3 is the same point on the opposite side of the body. Point 4 is in the soft tissue just inside the high point of the hip bone. Point 5 is the same point on the opposite side of the body. Step 2. With the palm open and flat, slide the entire hand under the recipient's body and place the first 2 fingers of this hand in contact with point T on the sacrum triangle. Then with the other hand touch points 1 through 5 and X. Point 1 is located just below the navel. Point 2 is in the soft tissue to the inside of the pelvic bone, low on the abdomen. Point 3 is the same point on the opposite side of the body. Point 4 is in the soft tissue just inside the high point of the hip bone. Point 5 is the same point on the opposite side of the body. And X, which is on the pubic bone. After completing this step, enhancements in local work may be performed wherever a recipient is experiencing difficulties of any kind. Step 3. In matching fire, touch points 1 and X, points 2 and 3, and points 4 and 5.
There you go, folks. Just that simple. And those are the sets we do for hormone imbalances. It's really quite simple. If you really took step by step together, it takes you 5-10 minutes maybe. And BioTouch is not something you got to do every day, 3 times a day. I mean, if you are working on any kind of hormone imbalance, and what's nice about it is it doesn't matter whether things are high or low or here or there. BioTouch helps you and your body regulate itself. We don't have to know what your numbers are. It's just whether it's a sleep pattern, adrenal responses, your glands aren't working right, it's, whatever it is, BioTouch will just help your body find its place of harmony. And the rest of it takes care of itself. And then you'll know what to do next. You'll know when to go see the doctor. You'll know when to take this supplement or that supplement. Or sometimes if it's bad enough, you might even have to take a drug. BioTouch can work with all of it. It doesn't get in the way of whatever you're doing. It can only enhance your health and well-being. We encourage you to download the workbook. It'll be up there right after the show, justtouch.com/workbook, and you can download this health condition workbook for hormone imbalances. We encourage you to support the organization, become a member. For $18. You can get the entire ebook training manual, and you can participate with us in some of our virtual trainings that we're just going to start here in June, where we'll take you through the whole program in 7 hours, 6.5 hours, and do from beginning to end, and that will be through a Zoom, and we'll actually sit there and watch you doing the points and answer questions and things like that. If you're here today because you are a nurse or a doula or a massage therapist and you signed up to get CE credits, just send me an email so I can send you the evaluation form. Otherwise, I want to thank you all for joining us. I want to thank DeeAnn Saber, Dr. DeeAnn Saber here in Tucson, Arizona, for her presentation for the first half hour. And thank you all for joining us today. And pass this on to other friends that you have. You'll all get an email with this. You can replay it on Facebook, and we'll also have it on our website. We have a whole section of health conditions, and just click on hormone imbalances. So, until next month, which, what is it next month? Prostate cancer we're going to talk about. And we have Dr. Steve Liu with us. He was with us before. Awesome acupuncturist who also talked about gut health. Otherwise, join us Mondays with Bev and Paul, 10 a.m. Tucson time. And if you want to learn more about how to participate in the organization and learning BioTouch, contact us, office@justtouch.com, or just go to justtouch.com. Whatever it is, keep touching, folks. Keep loving one another, and we'll see you all next month. Take care.